fight internal wildfire with fiber, right? Fight internal wildfire with fiber, right? And reason why this is important, right? And again, we're going to talk a lot about diet, right? In fact, over the next couple of weeks, we'll probably have an episode specifically focused on diet in relation to kind of chronic inflammatory disease, right? Because again, and as you can see, I'm not talking about diet and hypertension. I'm not talking about diet and diabetes or high cholesterol. I'm going to say chronic inflammatory disease, because it's the big bucket that I think if people can, and I'm seeing it, right? I'm seeing people start kind of having conversations about like this inflammation and inflammatory process and taking supplements, to anti-inflammatory supplements. I'm seeing it, right? But I want to make sure we put it together. Is I think a lot of times, especially in our healthcare system or our sick care system, I think a lot of times patients who have become, disinterested in, getting with the docs like me, is because they feel we aren't in tune with what's going on. They feel that we aren't hip to what's out there. And a lot of times we are. We're just having two different conversations, or so it seems. So when we say, hey, you need to kind of manage your blood pressure, you need to manage your diabetes, you got to do this with your weight, you got to work out more. People hear, oh, big pharma, they want to give me a medication to keep me on forever. But no,